Welcome to Report from Washington with your Congresswoman, Eddie Bernice Johnson. Each week, your representative invites policy experts to join her to discuss the issues that affect you the most here in the 30th District of Texas.
So I rise in strong support of H.R. 362 for 10,000 teachers and 10 new. This legislation is designed to strengthen our nation's scientific competitiveness. We do right and good by this country. When all of us assembled here this evening understand the magnitude of this moment. The time to act is now.
The Pledge of Allegiance will be led by the gentlewoman from Texas, Congresswoman Johnson.
And now, Congresswoman Eddie Bernice Johnson reports from Washington, D.C.
Hello and welcome to the Capitol Report. You know, on Saturday, November the 7th, about 11:30 p.m., the House of Representatives passed the Affordable Health Care for America Act. And today, I have as my guest Mr. James Clyburn, who had a big part in helping because he is the whip and he has to be responsible for counting those votes. And believe me, he works at it and he knows the subject. He can explain everything to do with the acts when he comes out to get the votes. Congressman Clyburn began his career as a high school history teacher in Charleston, South Carolina. He joined the administration of South Carolina Governor John Carl West in 1970, and he was appointed South Carolina Human Affairs Commissioner for 4 years later. So if that's a position he held up until I met him. He came to Congress in 1992. Highly respected. He has served the people in the 6th District of South Carolina since 1993, and he has served as the Democratic Caucus Chair, Vice Chair, and now the Majority Whip. We are very proud that he works really hard to make sure that we stick together as much as possible. Welcome to the show.
Thank you so much for having me back.
I know that you had lots to do during the deliberations on this healthcare reform. I know that I met with you along with others many, many times working out different little areas.
Absolutely.
And I think we have a good bill.
I think it's a great bill. And I want to, first of all, thank you so much for having me on the show. And thank you so much for all your help in putting this bill together. As you have been so modest here this morning, I think all your listeners know that you have a tremendous background in the delivery of health care. And I called upon that as often as I possibly could in order to make sure that we fashion a bill that would be not just efficient, but effective. And I try to tell people all the time that government is all about efficiency and effectiveness. If you have a good, solid, efficient bill and it's not doing good for the right people, then you don't have much. I think we struck the right balance with this bill. And everything that I hear from people who have had time to study it, they are pleased with the product. Now, that is not to say this is exactly what the Senate will do. The Senate will do something different. And that's why we have conferences here. So when the Senate finishes its work, both the House bill and the Senate bill can then be subject to a conference by representatives of both bodies, and hopefully we'll come out with a good bill that will also be a balance.
Now, we both have been here long enough to know and to understand that no bill is perfect.
No.
But this bill has more positive than negative. And we know that we're not going to disintegrate after it becomes law. I'm just so hoping it will become law.
Right.
We can tweak as we go along if it's not working.
Absolutely.
I'm hearing a lot of things that I don't know about the bill.
Sure.
That seem to be misinformation.
Yeah. Well, there are some things that we have to explain to people. For instance, this bill, though it will not take effect until 2013 in toto, that means that this big part of this that people talk so much about, the exchange, which is where the public option is, that will not come until 2013. But there's a lot about this bill that will go into effect immediately upon signing by the President. To be sure, when this bill is signed into law, we will immediately put in place a high-risk pool for people who do not have insurance so that they can get into being covered right away. We won't have to wait until 2013. Now, the interesting thing about this high-risk pool is that that's one of the Republican proposals that we put into the bill. People may remember that's one of the things that John McCain ran on when he was running for president. We put that in here. There are 23 different proposals offered by Republicans that are in this bill. Now, they put up around 129 proposals. We accepted 23 of them. But if you listen to them, they will say that they had no input in the bill. But that's one of the things. Another thing that they talked about a lot that we put into this bill is the ability to go across state lines to sell insurance policies. That's one thing they talked about. That's in the bill. They talked about us doing something about medical malpractice. We have put proposals on medical malpractice into this bill. So if you look at it, there's a lot of bipartisanship in this legislation, and I want the public to know that. Now, some of the things that will happen immediately, I think is important. For one, you will no longer be able to rescind coverage from people if they contract a catastrophic illness. That will be immediately. Mm-hmm. We will also immediately allow students or young people, I say students because that's, that's why we did this, to stay on their parents' insurance policies up to the 27th birthday. Because one of the things we found is that a lot of people, after 4 or 5 years of college, would go on to professional school and would then find themselves without health insurance. In this bill, we allow them to stay on their parents' policy up to the 27th birthday. Another thing that's immediate in this bill is you will immediately be able to have prevention care or services without having to pay high co-payments and high deductibles for that. And I think it's important that the new, what we call denials for pre-existing conditions, we modify that immediately. Now, you won't get the full benefit of that until 2013, but immediately upon the signing of this bill, we will limit the ability of insurance companies to look back into your past. I think it, rather than 6 months, I think it's 3 months you can look back in order to determine whether or not pre-existing conditions ought to come into play. Now, that is until 2013. After 2013, we complete that, and you won't be able to deny at all because of pre-existing conditions. So there are a lot of things in this bill that's immediate that I think is great, that's good.
And I hear, too, that people feel they're going to lose their insurance. If they like their insurance, can they keep it?
Oh, sure. In fact, that's the big part about this bill that I don't think we talk about enough, and that is what is in this bill for people who already have insurance. Number one, we know that around 83% of the people in the country have insurance. So what's in it for you? Number one, you can keep what you've got. You like what you got, you keep it. But secondly, what we're doing here is saying to those people with insurance, we want to see your premiums reduced. You pay from $1,100 to $1,400 a year for the so-called cost shifting that takes place in insurance. That is to say that those of us with insurance are having costs shift to us because of people who don't have insurance. We know that people in this country without insurance must be treated at the emergency rooms. Somebody is paying for that.